Mandy Cohen, it is too little too late. You have actively downplayed COVID. You played hot potato with the vaccines, basically going, not our problem anymore. That's not the private health sector's problem. To say the new vaccine rollout was fumbled is an understatement. Where were the mass vaccination clinics? Where is the easy transition guide going from this is what the vaccines were called, this is what they are called now? This is why everyone age 6 and up should get it. This is why the Advisory Council on Immunization Practices decided to do that. So with your lack of urgency, with your lack of care, you're now sending up an alert far too late. And in your alert, you're saying low vaccination rates amid ongoing increases in national and international respiratory disease activity, aka COVID, could strain U.S. healthcare systems in the coming weeks, and called on doctors to encourage their patients to get their shots immediately to protect them for the remainder of the season. Again, the CDC, you're outsourcing your responsibility to individual practitioners when you should be communicating this message loud and clear and concisely. Where your numbers are saying that just 17.2% of adults have received the updated COVID shot, and somehow we're missing a children's COVID vaccine statistic here. But again, remember, these are not official numbers. These are them calling on the phone being like, hey, did you get the vaccine? Okay. Hey, did you get the vaccine? Okay. These are survey numbers. These are not actual numbers. And to make matters even worse, we're seeing an increase in multi-system inflammatory syndrome in children, MIS-C, which is directly due to COVID. It's a complication of COVID. And there is an increase in children getting this condition right now. Because again, children can get COVID, children can get long COVID, children can be very severely impacted by a COVID infection. So unfortunately, the CDC has off-shifted the burden of public health onto the public. So please protect your children, get your vaccines. You can get them both at the same time. You should probably do that at this point. If you have not already and it is safe for your child to get vaccinated, there are multiple options, and if you can't get vaccinated for one, at least try to get vaccinated for the other.